With more than half of U.S. adults having at least one dose of a COVID vaccine, states across the country are continuing to lift restrictions put in place when the pandemic began. In Washington, D.C., most restrictions and capacity limits will be lifted starting May 21st. However, bars and large sporting venues will have to operate at 50% capacity. The mayor set June 11th as a date for when restrictions will be lifted for all establishments and venues. In New York City, people can get vaccinated starting tomorrow at various pop-up sites around the city. Some of those pop-up sites will include various subway stations, and those who get vaccinated will get a 7-day free Metro card in exchange. Philadelphia has revealed its timeline for reopening the city. It will start lifting restrictions on May 21st for stores, libraries, offices, and more, and the city will be fully reopened by June 11th. An article in The Atlantic entitled "The Liberals Who Can't Quit Lockdown" talks about how some of the more liberal policymakers have left scientific evidence behind them in favor of tougher restrictions. For more on this, I want to bring in Emma Green, a staff writer at The Atlantic. Hi, Emma. Thank you for joining us. Great to have you with us. Explain to us, why you write that these liberals who at the outset of the pandemic were so adamant about stressing the scientific evidence are having trouble moving away from some of the lockdown restriction requirements now that the scientific evidence is suggesting that they can indeed do so.
I started noticing this in my own neighborhood, watching fights play out on Twitter, surveying different conflicts that were happening in very progressive communities across the country. It seemed like really progressive cities and towns were actually home to some of the fiercest fights over COVID, where people who really shared a lot of the same policy goals when it comes to the Green New Deal or Black Lives Matter were really fiercely divided over what the right path to take on COVID was. This was coming in small ways over things like, for example, keeping playgrounds shut down in California. The state of California kept playgrounds shut until early December, long after we knew that surface transmission really isn't the primary way COVID is spread. But it also came to a head over really big issues like school reopenings. And I followed a community in Massachusetts that really had a tough time coming to a consensus over a safe way to get kindergartners back onto the rugs of their classroom teachers.
So how does your reporting show that pandemic restrictions have become a political issue? I mean, I live in New York City, and I do see that now people are struggling with the issue of whether to wear masks outside or not, even though the CDC says you really in general don't have to if you're vaccinated. I still see people wearing masks outside, and maybe it's my imagination, but I feel like when I don't wear my mask because I'm fully vaccinated and I'm outside, as the CDC has said is okay to do in certain circumstances, I feel like I do get dirty looks. And I don't know if that's in my head, but is that something that you are also bearing out in your reporting, that certain communities have standards that you feel like you have to maintain just to maintain this image of being a good community member?
Absolutely. One of the things that I looked at in my article was the fact that some of the places in the country that have gotten hit hardest by COVID, which includes New York City, last spring was just horrible for New Yorkers. These are also places in the country where a lot of progressives live. I talked to a doctor who works at the University of California, San Francisco, named Monica Gandhi, who was talking about exactly what you're describing, that when people go for a bike ride outside in San Francisco, there's this wave of dirty looks that follow people. And really, again, that doesn't cohere with what we know about the science. We know now that being outside is one of the safest places you can be during COVID, and the possibility of spreading COVID if you're on a solo bike ride for 15 miles an hour is just really pretty low. So I do think that there is something cultural here that in certain progressive communities, following COVID guidelines and giving up a lot, making a lot of sacrifices has been almost this civic duty, this expression of good citizenship. And I think now that we're moving towards getting more of the population vaccinated, and as we know more about how COVID is spread, it's been hard for some people to give up on those restrictions because, again, it's like giving up on this notion of good citizenship that we've had to hold on to for the past year.
Right, and masks are such a visual symbol of it, right? So what do you think it will take then for, some of these people, some of these communities to feel safe about reopening and appearing without those masks in public where it's safe, obviously where there's space and the rest of it. What do you think will need to happen in those communities?
One thing I heard a lot in my reporting was a sense that even very progressive people who generally believe in science and trust public health authorities and expertise, that they have had a hard time trusting the CDC because they believe that it was co-opted by the administration and was leading with political messages rather than scientific ones. So I think restoring trust is a big one. I think clear messaging from the CDC is another. A lot of people, I think, are behind the times on where CDC guidance is, especially for fully vaccinated adults. There's been a lot of mixed messages about what we can do and what's safe. And I think finally, policymakers really have a responsibility here to be clear about why they're making the decisions that they're making. School reopenings have been very, very controversial, but more and more evidence is suggesting, for example, that kids can be in classrooms safely. It just requires a lot of mitigations, a lot of safety protocols to be put in place. And we still have policymakers who are saying, I don't know if we're going to be able to be in person next fall. So I do think that policymakers in these very progressive communities also have a responsibility to really be transparent about what standards and evidence they're using to make their decisions and to listen to the concerns of people who might disagree with the paths that they're following.
Right, absolutely. Well, Emma Green, thank you so much for joining us and sharing your reporting with us. We appreciate it.
Thanks so much for having me on.